So feel free to ask questions while I continue the sessions. I'll be happy to answer. In fact, actually, I have already have few questions that we have been running stories for quite some time. So we got few questions, and some of them are very interesting ones. So very happy to go through them at the beginning. But if you have any questions that you want me to answer, I'll be very happy to do that. Dental scaling is or dental cleaning. Both are the same. Dental scaling is like more of a technical term that we use in the clinic. But now more and more so, most of the patients are aware of what dental scaling is. So that's great. But it's the same. Teeth cleaning and dental cleaning is all the same, or dental scaling is all the same. Now, the dental scaling is more professional way of doing the cleaning treatment, and we have different options. We have manual options. We have ultrasonic devices, which is very easy to remove the stain and the dirt. I'll come to that a little bit more as we go along. For now, it is important to understand that it's a very safe procedure, and there is no damage done to the teeth whatsoever. And we do have a lot of patients coming on a regular basis to have their teeth cleaned every 6 months. And and most of these patients have, okay, just a second. So my team is here sending me some of the questions that have been, yeah. So yes, Arpita, I got your message here. So dental scaling and cleaning, they both are the same. Scaling is the more technical term that we at the clinics use. Like I was saying, but it's the same. It's the professional way of using our instrument. And most of the time, the instruments that we use, the hand instruments or the scaling instruments that we use, or I should say the name of them is scalers, hand scalers or ultrasonic scalers. And that's where the term has come in. It is called dental scalers as well. So both are the same, yes. So yes, it's a very safe way to have your teeth professionally cleaned. Although some of the patients may experience dental sensitivity, pain, bleeding gums, sore gums during the treatment or even post treatment. I'll come to that a little bit towards the end, so to have an understanding as to how that happens and why that happens. But if you are someone who have their teeth cleaned on a regular basis every 6 months, then the chances of you having all those sensitivity or any dental or sore gums or anything will be much lesser. So again, so that's where the topic of today is: importance of having your 6 monthly routine checkup and cleaning. It's very important. And one of the reason is that if you are doing this on a regular basis, we'll never have sensitivity or even bleeding gums or sore gums. So that is there. Dental cleaning. Now there are different types of cleaning. Again, there's a deep cleaning, there is a root cleaning, and it just goes on. But basically, the dental cleaning is the most superficial part of the treatment. The idea about this is to remove the superficial, the dirt that's stuck on the tooth, and thereby improving the health of the teeth and the gums, and it has got many other benefits as well. So what are we generally removing? We generally remove something called plaque, which is a soft debris or mix of bacteria and food debris that layers on top of the tooth surface. So this can be effectively removed by proper toothbrushing. Yes, you can remove it with toothbrushing if you are very good at it. Now, in toothbrushing, there are different ways and techniques of improving the quality of your toothbrushing. And this is again something that we educate our patients when they come to our clinic on a regular basis. So when they come here, we do the cleaning, scaling and polishing and everything, and then we advise our patients as to how how to keep their teeth healthy and clean. Okay, so or in an effective way to remove the plaque deposits. Now, if the plaque stays on the tooth surface for a long time, then it hardens over a period of time. So this hardened surface is called calculus or tartar, and they are quite impossible to remove just by brushing or flossing. And that's the reason why, that's when most of the patients come to us, and we have to remove all this with the help of the dental scalers. And even if you are very good with your toothbrushing, I would say that there are areas where it's hard to reach areas. It's quite impossible to clean up these areas. And the only way to reach them or to remove them is by professional cleaning, because this is, again, as a trained dentist, doctors who have been working on patients on a regular basis, we know exactly where the patients struggle to clean. So one of the things during the treatments, when we do the cleaning, we identify areas where there is quite a bit of a chance for this plaque and calculus to be deposited. So when we see this, we advise our patients to how to brush, how to reach those areas with their toothbrush or floss, and try to keep them as clean as possible. Now, most of the time it is, if your teeth are very well aligned or straighter, it becomes a lot more easier to have, to keep the teeth clean. But if the teeth are crowded, a lot crowded, then again, it's impossible for the brush to reach each and every nook and corner to keep them clean. So that's another reason why visiting the dentist again, on a regular basis is quite important. So what happens when you leave this debris there, like calculus and plaque there for a quite long time? Number one is it starts encroaching between the teeth and gums. Now, between the teeth and gums, there's a small area called sulcus. So it's like very, very tiny area of sulcus. So, and it's a very natural process. And when you brush the teeth, you have to angle the toothbrush in a 45-degree angle so that you can brush into the sulcus and keep them clean. But sometimes, especially in hard to reach areas, it might be very challenging to do this treatment, or to do a proper toothbrushing. So that's when, if it's not kept clean, the plaque will harden to the calculus, and the calculus will start engaging or encroaching between the tooth and gums, and it'll start pressing more deeper. And this is what we call as pockets. So the sulcus will turn into pockets, and these pockets are, again, very challenging to clean. It's or next to impossible. So this is where we have to do more advanced treatment like root planing and many other treatments. And it can be completely avoided if you are visiting the dentist on a 6-monthly basis. All right. I hope that was very clear. Next time I'll get some props so that you'll be able to understand better the conditions better. But the one of the most important thing that you will have to understand about the dental cleaning or scaling, more than a treatment, it's a preventive process. We prevent the cavity, or of course the cavity, from developing. If the dirt stays longer on between the teeth surface, yes, there is more higher chances of developing a cavity. But at the same time, gum disease are mainly like the beginning of a gum disease is gum bleeding, and then eventually it leads to swollen gums and so many other factors. The gum line, the proper gum line. Say, for example, if your gum line is somewhere here, and if your gums starts to recede. Now, there are many reasons why your gums can recede. One is if the dirt stays in your mouth for a longer time and it develops into calculus, the calculus encroaches between your teeth and gums. It will start pushing your gums away from the tooth, and your gums slowly, gradually will start going down, and this is called gum recession. So another reason is heavy brushing. If you brush too hard, especially with a hard toothbrush, and if you brush for a quite long time, yes, it can also cause your gums to recede. And excessive grinding or clenching. So people who grind the teeth at night, this can also cause, sometimes, not in all cases, sometimes cause the gums to go down. So if your gums go down, so our teeth has two surfaces, the enamel surface, which is literally the crown, on the crown of the tooth, and then the root surface. The roots are not coated with enamel. So and they can be, for some patients, they can be very sensitive. So when we do the cleaning around those areas, yes, some of the patients can have kind of a sensitivity during the process. So to overcome this, what we do is we kind of apply a numbing gel around. That will help, but not completely. That will help a little bit. But the patients who have hypersensitivity is something of milder form. Hypersensitivity is like more severe form. So even with just a drop of water, if the patients feel a lot of sensitive, then we may have to put it under local anesthetic to have the cleaning done effectively. But generally, if you have a very healthy teeth and gums, it will never hurt. The scaling should never hurt. So that is, I hope that was useful and self-explanatory. Now, what can we do about the receding gums? Well, one, it depends on how much of the gums are receded. If it is like in a very mild format, sometimes, not always, sometimes just by cleaning, your gums can regrow to its old position. But if it is very mild, but if it is severe cases, then two choices, depends on how far the gums have receded. If it's a very mild one, again, or moderate one, we advise our patients to observe. We put them under observation, especially if it's not in aesthetic or cosmetic concern, then it's okay. But if it's more advanced, then we have to go for something called flap surgery, wherein we reposition the gums to its position. But again, that requires a more detailed explanation. And since our topic is not there, I'm trying as much as possible to stick within the forms of what our topic of the day is. But just an idea that your dental scaling will not hurt. It will only hurt if your gums are receded and if the root surface is exposed. If you have cavities, yes, that can also cause a little bit of sensitivity during the cleaning. If you have old filling, which is quite old and loose, when we do the cleaning, because it might vibrate, especially the ultrasonic scalers might vibrate a little bit and causing sensitivity. So these are the reasons why the teeth can be painful. Gums generally are not painful, but sometimes there can be ulcerations on the gums. And if there are certain ulcerations, yes, during the cleaning process, it can be painful. Again, application of this numbing gel or something can calm the gums down so that we doctors can do an effective job. The good thing about the gums are it responds to the treatment very well because of the high vascularization. What do I mean by that is there's a lot of blood supply. So which means a small cut can cause a lot of bleeding as well. But the idea is like if as soon as we remove the cause, if you remove the calculus or debris and deposits, your gums will thank you for it and will start healing quite faster. So this is so that's the good thing about the gum disease or gum treatments. But at the same time, gums rarely hurts. It doesn't cause like a lot of problems or a lot of pain. But the problem over here is like the people, as long as sometimes some of the patients do not come to the dentist unless and until it starts paining or aching. So if there is a tooth cavity, for example, if it is a small cavity, nobody comes in on time to have it fixed until like it breaks down into a bigger hole and there's a lot of foot trap. That could be the one. Or maybe the cavity could advance much deeper, causing like severe pain, and that's the time that patients might come in. And all of this have a different level of treatment. Say, if it's a small cavity, we can quickly fill them in. If it's a moderate cavity, we can still save the tooth. If it's a deep cavity and causing a lot of pain, then we'll have to go for advanced treatments like root canal treatments and so on and so forth. But when we talk about dental cleaning gums, it rarely pains. And sometimes I've had patients who had come and say, I'm not comfortable with my gums or my teeth. and I'm not comfortable when I chew food properly. So when we look into their mouth, we see the gums are really swollen, and the tooth might be a little shaky. Now, the mobility of the tooth, we call this a tooth mobility, and tooth mobility has different levels. So again, it depends on the amount of calculus, the debris around. Remember, I told you the amount of when there is a deposit that's around the neck of the tooth, it will start pushing the gums downwards and also encroach in between the space between your teeth and the gums. It starts opening up. These are called pockets. And then it will start hitting the bone. Once it starts nearing the bone will start going downwards, loosening the tooth. So, and if it's mild to moderate mobility, there's a good possibility that as soon as we do the cleaning, your teeth becomes more stronger, and then it should be okay. But if we leave them for longer, then your teeth goes into the next level of mobility, which is called grade 2 mobility, wherein we may have to do advanced surgeries in order to save the tooth. And the last one is grade 3 mobility, wherein it's really hopeless. We have to remove the tooth out, and then we may have to go for a replacement of the missing tooth with dental implants or any other process. So all of this can be avoided if you are proactive in taking care of your dental health and visiting the dentist every 6 months. All right. So that is about the topic. You please, if you have any doubts, any questions, please reach out. I'm here, and I'll try to answer as much as I can. And I hope I'm being as clear as possible. I'm trying to avoid all the nasty things as much as possible. Uh, I don't want to scare my subscribers away and reduce them. So I want you all to be engaging, and it will feel nice that I'm not talking to a camera over here, and I know that I'm talking to a friend out there. So another question that I have is, will scaling make my teeth whiter? Well, okay, that's a good question. To a certain extent, yes. If so, so far we have talked about uh, the plaque, the calculus, the deposits around the tooth surface. And yes, they can be a little yellowish in color. Sometimes they can be orangish in color, and they have many other colors. So this can actually dull down the tooth also. So simply by cleaning off this teeth in itself can improve the quality of the shades of the teeth. Now, there are other reasons why the teeth can dull down. And this could be due to stains from smoking, from specific coffee, or certain medications. Now, these, if it is visible stains, we might be able to remove most of them with a dental scaling, and that might in itself can change the few shades of the teeth, making them look more whiter. To have an effective shades, if you want to take the shades to a much whiter level, then we'll have to go for a teeth whitening. Maybe that's a topic for another day. But yes, some amount of shades might be changed just by cleaning itself, by cleaning itself. Yeah. And another question is dental scaling necessary if I brush and floss regularly? Oh, that's a good question. Okay, so I think I covered this before. Like, even if you are very good with the cleaning and polishing, I mean, if you're brushing and flossing and everything, if you're very strict with your oral hygiene routine, that's good. I would like to congratulate on you. And sometimes some of my patients, when they come, I see it's like spotless. And most of the time when I ask them, they have a very strict oral hygiene routine. And I'm very happy to see when patients are engaged with that. But again, like I said before, even if it's not for cleaning, every 6 months checkup is ideal to have a look into your mouth. If you smile and the gaps are visible and you're not comfortable with them, then we'll have to do something to protect it. So one of the way is to do a composite filling, which is the best way because we don't cut or grind your teeth or there. Another way is to go for veneers. But sometimes the deposits in between the calculus or tartar can also migrate the teeth or push the teeth away and again widening the gaps. So this is a problem. So if that's the case, then we will have to clean up, and we can go for braces or aligners to close the gap back in. Or if it's very mild, if you don't want to go for that, you can also do the composite bonding, which is quick and fast. But this again only cements the idea of having your teeth cleaned and checked up every 6 months. So whenever you do the cleaning, immediately when you go to the back to the reception, please book your next 6 monthly appointment, because even if it's tentative, even if it's something, just put it there, because the clinics, no matter where in the world you are designed in a way to give you a call back when that happens 6 months, or a reminder. They'll send you a reminder that you are due for a care, and you can be ready for that appointment, or you can at least book that appointment with the following week or something like that. But every time that you visit the dentist, have your teeth cleaned, go to the reception, and do not say like, okay, I'll get back to you, because when you say that, the receptionist do not enter your name get your name into the calendar, which means it's forgotten, and then you are never reminded on. So it's better that as soon as you leave the clinic, go to the reception, make sure that you book in your appointment. And this way you will be able to keep your 6 monthly appointment on time. So are there any side effects after dental cleaning? Well, there are no side effects, but there could be, sensitivity can linger for quite some time. Bleeding gums can be there for a day or something, and then after that it should be gone. Most of the time, if there is sensitivity, your doctors will prescribe you any toothpaste to reduce the sensitivity. Or if it's very mild, it will go on its own. Within a day or two, it should pass. But a good high quality toothpaste can also reduce the sensitivity, and it should be okay. And for bleeding gums, it again depends on the amount of bleeding. So sometimes if it is very, very mild, we just tell our patients, do not worry, it will just go on for in a day or two. But if it is severe, if there's a lot of bleeding, we may prescribe you a specialized mouthwash. So that can help you to not only stop the bleeding, but also rejuvenate your gums to be more healthier. So this is something that is subjective for every case. But mild, which reverse, I would say it's a reversible side effects. It's not actually a side effect, to be honest. Yes. So how should I care for my teeth after scaling? Well, this again, well, most of the time, after the cleaning, the doctors will train you how to polish, how to clean, how to brush your teeth and floss. If you're not done flossing yet, um, uh, be honest, talk to the doctor and tell them like, you have no clue about the floss, and the doctors will be happy to walk you through the process, to help you, to guide you how to floss. And brushing, yes. Toothpaste is yes, but more so flossing. I cannot stress the importance of flossing, because that's where most of the cavities develop, and that's also a place where most of the dirt gets accumulated. So flossing is the best way to do that. So muscle flossing, and you'll be able to minimize or reduce plaque deposits, calculus deposits, cavities, and many other dental conditions. Most of the questions are actually repeated. Let me see. Are dental x-rays necessary during the visits? Well, again, so as doctors, we have, if you are very specialized, for me, I've been doing dentistry for 25 years. As soon as I see a tooth, I know that there might be a problem, one or two, which is under the surface, which is not visible. But sometimes I could miss out on a few things. So that's the reason why we do take a X-ray. And most of the time we go for panoramic X-ray, which goes from one end to the other. So we get the whole teeth in one film. And the purpose of this is to identify if there is any new cavities that's growing underneath it. Now, it's not necessary to take an X-ray every 6 months that you come here. Again, it depends on case-to-case basis, but most of the time, if you are free of any disease like a cavity, no problems, everything is good, very healthy teeth and gums, then once in 2 years, once in 3 years, that's good enough. But if you have multiple fillings, there's so many fillings in your mouth, and it'll be nice to have an X-ray taken once a year or once in a year and a half. The reason being, most of the fillings, especially if they're old, they starts opening up between, there's a space that can open up between the filling and the tooth surface, creating a small tiny gap into which a new or the bacteria can enter and a new cavity can start under the filling. So as a doctor, when I look into your mouth, the filling is intact, but this kind of problems we can only detect it when we take an X-ray. So that's the reason why we advise our patients to go for X-ray on a more regular basis. Otherwise, if your teeth are good, your gums are good, healthy, then it's not really, really important. But if you're not done for a couple of years or two, we might tell, okay, you're not done for a long time. It's better to have one done just in case. All right. So can I eat immediately after teeth cleaning? Yes, you can. 100%. There's no problem. But if you're sensitive and all, like, I will advise you to wait it out for about half an hour to an hour before you can start eating or drinking. But if it is not, you can start. It's okay to have your food immediately after. There is most of the questions I have answered. I guess you guys. There is one question: will my insurance cover these dental insurance, the dental cleaning? Most insurances do cover the dental cleaning, but uh, uh, some insurance we found that it's only once a year. Some do twice a year, and some do not even cover for some reasons. They don't have this in their insurance at all. So it's again subjective to your insurance. So when you are going for your insurance, if you are buying your insurance from your pocket, it's better to go for like what's covered, to understand what's covered and what's not covered based on what your hygiene is. You will know better. Or if you have some doubts, you can come or you can go to any of the dental clinic or dentist, ask them to give you a report so that you get to understand what is required. And then based on that, you can approach the insurance companies to get a proper, understanding. So that you will not be left out, because many times when patients come here, everything else is covered, but what is required for them is not covered. And then they end up paying out of their pocket. But again, dental insurance, well, it's a good thing to have. But if you are on a regular basis visiting the dentist every 6 months, I would say it's even cheaper than buying an insurance. So because if you are very strict with your hygiene, with your brushing, with your flossing, and with your 6 monthly appointments to check and clean and everything, very rarely you'll have any requirement for a extensive dental treatments, and your expense will be limited to a very bare minimum. So it shouldn't be a problem, major concern. But if you're getting insurance from your company or anything, maybe you may have to reach out to your HR and take a note of like what's covered and what's not covered. Be sure of it. And unfortunately, you cannot top up the company insurance because it's a group insurance. Then compared to individuals, when you are taking up, you will be able to customize it based on your requirements. Hopefully, not all insurance do that, but sometimes it depends on the package that you have to go for. Okay, I think that was a good run. I was only planning on half an hour, but it took like nice 45 minutes. I'm happy though. We enjoyed the feedback, definitely, because this is going to help us a lot to how to make it even more better. We'll also bring the rest of the doctors. We have a gum specialist on board. We have a implantologist on board. We have restorative dentists. We have all the doctors over here. So if there is anything that specific that you want us to cover, yes, we will come back and we will be sharing that information with you as well. So I guess that's all for today. I guess everything is done. So I'm just looking at my team back. Are we done? Are we good? Okay. So thank you so much for watching. It was a pleasure. I enjoyed it a lot. And I hope you got value from this. And that's the whole purpose, to provide as much value as possible. And thank you again. And this is Dr. Salah signing out.